So in between, so this all happened then through January 10th, and then lawyers weren't allowed back in until the end of January, beginning of February. And then, and another 6 weeks goes by, everything gets closed down again because of COVID.
Right.
In the official figures, Sousa was not hit hard in the official figures
Right.
of testing and whatnot. Did you go in during that time period while it was still open to lawyers? And did you see evidence that the protocols for limiting the spread of the virus were being adhered to?
So I did not go until, I'd say, mid-August, up until about 2 weeks ago. I've been there numerous times.
Mhm.
And I saw several COs in the restrictive housing unit who were not wearing masks at all. Others had their pulled down very low. The prisoners, they've had the same mask for weeks. I met with one person whose mask had started to rip, like right down the middle, and there was no way to hold it up over his nose. So, I've got a decision. Can I do my job here? Or with this guy's nose exposed and this really old, grimy looking mask on, or do I leave? And so, because more recently I've been there to investigate whether the Department of Corrections is in violation of a preliminary injunction, which requires them to allow the prisoners to have access to their legal documents and enough time to call the attorneys. I was put into a small room with a prisoner I didn't know. I suppose the room has to be bigger than 6 foot by 6 foot, but barely. Put into a room with somebody with a weeks old mask on. In this closed space, there's no vents in there. There's no panic button. There's no intercom, and they locked me in there. I really hope that he didn't have COVID, because I don't think there's any way that if he did, that I don't have it. Situations like that are extremely dangerous for numerous reasons. My physical safety, but also my health. And with the amount of COs who aren't wearing masks, or they're wearing their masks pulled down, the prisoners are not all wearing their masks. I don't know that they wear them at all when they're back in their cells or in their housing units, but it's not a safe environment. It's not. And I will not be going back there probably for the remainder of the year because I'm concerned for my health and safety.
Why did they put you in a meeting room with someone who wasn't your client?
So we were there to investigate the injunction, and so we had to make appointments so that we could meet with the people we were interviewing in the large visiting room at a conference table that would be set up with all of the papers that prisoner possesses, from storage, from their cells. And so I had an appointment. We were doing it that way all day. Towards the end of the day, somebody decided that the prisoner I was meeting with, that his enemy should come to that room for a video chat with his family. And so my choice then was leave, or leave and have to come back another day, or to finish, the interview in that small room. And I chose to go into the room. What I didn't know was that they locked me in. I didn't realize that until I tried to leave the room and wasn't able to, and I was banging on the glass. It took them an uncomfortably long period of time to come in. And in the meantime, the prisoner who's the enemy of the person I'm meeting with is in our direct line of vision and just staring right at us. And I was told that because we, meaning defense lawyers, complained about having to have non-contact visits, that this was the new policy, was that we would get contact visits, but if they decided that, the prisoner you're meeting with, his enemy, has come to the visiting room, they just lock us in. And, like I said, it's unsafe physically, it's unsafe health-wise in this COVID era. And I think that it's going to stop a lot of attorneys from going back, period. I know that I will think long and hard about whether it's necessary that I go there if I know that there's a chance I may be locked into a room, even with a client that I trust. It's not safe.
Yeah. So, just as a final question, what do you think should be the response to all of the allegations of what sound like systematic human rights abuses in the wake of the January 10th assault on officers, and then also in terms of lapses in some of the COVID protocols as well.
There needs to be an investigation by an outside agency, by the federal government, somebody other than the Department of Corrections, and somebody who's not under the direct supervision of Governor Baker. He has routinely stuck by the COs no matter what. And when you're getting that sort of support from the highest person in the state, you are going to continue doing what you're doing. And so I think it's really important that he have no say whatsoever in an investigation, and that whatever recommendations are made to be implemented. I think we're not going to see any big changes in corrections until they change the training. I've been through the training. I know firsthand, you're taught to be terrified of these prisoners. They're going to kill you. Doesn't matter what, they're going to kill you. They're going to rape you. They're just looking for a way to take over this place. And so you are necessarily working in an environment that is just filled with fear. And when people are fearful, they act in ways that they wouldn't otherwise act. And I think that that really is the primary reason for the problems that we're seeing, especially as the higher the security, the more the problems, because there's this fear that's kind of pounded into their heads.
Thank you very much for taking time to speak with me.
Thank you for being interested in this. It's really important, and I'm glad to see that more people in the public outside of my profession are starting to notice and pay attention, and hopefully that's going to lead to some lasting change.